Welcome to Quaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
Hey everyone, welcome. In this explainer, we're going to break down the patient-driven payment model, or PDPM, and really show you how the clinical work you do every single day directly shapes not just patient success, but also your facility's reimbursement.
Okay, let's just dive right in. The biggest, and I mean biggest, shift with PDPM is this. We moved from a system that basically paid for the quantity of therapy to one that pays for the quality of care. It's all based on your patient's unique, individual clinical needs. The bottom line? It's no longer about how many minutes you log, but about the specific needs you meet. So here's our game plan. We're going to walk through this new landscape together. We'll start with that big shift from volume to value. Then we'll break down the 5 pillars that kind of hold up the whole payment system. And then we'll get to the most critical part, how your documentation and teamwork come together to create better care and, you guessed it, fair pay. So let's start with the basics. Before we get into all the nitty-gritty details, we need to be really clear on what this system is and what it's trying to do. You know, at its heart, PDPM is designed to pay more accurately for the specific and often very complex needs of each person you treat. It's a system that finally recognizes, on a financial level, what you as clinicians have known forever. No two patients are ever the same. So, how does the system actually calculate the payment? Well, it's built on 5 distinct components. Think of them like pillars holding up the entire structure. Each one represents a different, vital piece of patient care. Now, here's what's so fascinating about this. Look at this table. 4 out of these 5 pillars are driven directly by the clinical details that you and your team document, right? The PT and OT parts, they're powered by function scores and diagnosis. Speech, it's all about swallowing and cognition. And nursing, that's driven by those high-cost services. And all of it, every single piece, flows through one critical tool. And that brings us to the MDS, the minimum data set. This is why your accuracy here is absolutely non-negotiable. It's not just more paperwork, you guys. It's the engine that literally determines the payment rate. It is a single source of truth for both the care you're providing and the reimbursement you earn for it. Okay, this brings us to the most important part, your role in all of this. We've talked about the big picture, but now let's see how your specific daily documentation becomes the most powerful data in the entire building. For all the nurses and therapists out there, coding Section GG accurately is essential. The key phrase here is usual performance. We have to document what the patient usually does over that 3-day window, not their best moment and not their worst moment. And having consistency between what therapy says and what nursing says across all shifts, that is absolutely key for compliance. Now, beyond just function, the NTA component is where we capture that deep clinical complexity. When you screen for conditions like these, you're making sure the facility gets reimbursed for the expensive resources these patients really need. Think about it. A patient with a BMI over 40 needs special equipment. A patient with an IV needs skilled observation. Capturing this stuff is vital. This quote right here, it really nails the mindset shift we all have to make. The goal is to document what the patient actually does. That's what reflects their true functional ability. So, if a patient can do a task with just a little bit of setup help, but we jump in and do it for them to save time, we have to document their ability, not our action. So, if accurate individual documentation is the foundation, teamwork is how we build the house. Let's look at how all these individual pieces can come together to create some real clinical magic. Check out this synergy right here. It's perfect. The therapist identifies the barrier, pain, and documents exactly how it's holding the patient back. Then the nurse provides the clinical solution, timing the pain meds so that therapy can happen when the patient is most comfortable and most able to participate. That's how we maximize progress. Now, this is truly a life-saving collaboration. The SLP's assessment results in a strict medical order. This is not a suggestion, right? It's an order. And the nursing and CNA team's adherence to that specific diet, those specific precautions, is literally what prevents aspiration pneumonia, a huge reason for hospital readmissions. And here's a fantastic example of being proactive. When a therapist identifies early on, like in the first week, that a patient is going to need a walker at home, it gives the social services team the time they need to get authorizations and coordinate everything. This is how we make sure that transition home is safe and smooth, preventing those dangerous delays. So, you've got accurate documentation, you've got seamless teamwork. When all these pieces click into place, what's the ultimate payoff? What's the end game of mastering this PDPM model? If you take just one thing away today, let it be this. Excelling at PDPM is not about chasing reimbursement. It's about accurately capturing the incredible, complex clinical work you are already doing. When you focus on delivering and documenting excellent patient-centered care, fair reimbursement will naturally follow. So, I'll leave you with this thought to take back to your team. What if you started viewing every note, every MDS code, not as a chore, but as a piece of a larger strategy? When you do that, you empower your entire team. You move beyond just being compliant, and you start to truly drive better patient outcomes and prove the immense value you provide every single day.
Brought to you by Quaderno KO. Learn smarter, not harder.